Mrs. J is in the adult ICU on a ventilator. The nurse caring for her recognizes that her endotracheal tube needs suctioning. Based on the nurse's understanding of this procedure, what level of pressure should the nurse apply while suctioning? A. 70 to 80 millimeters of mercury. B. 100 to 120 millimeters of mercury. C. 150 to 170 millimeters of mercury. D. 200 millimeters of mercury. The answer is B. 100 to 120 millimeters of mercury. When suctioning the endotracheal tube of an adult client, the nurse should set the suction apparatus at a level no higher than 150 millimeters of mercury, with a preferable level between 100 and 120 millimeters of mercury. Suction pressure that is too high can contribute to the client's hypoxia. Alternatively, too low of suction pressure may not clear adequate amounts of secretions. The nurse caring for Mrs. J is prepared to suction her endotracheal tube. Which of the following interventions will reduce hypoxia during this procedure? A. Hyperoxygenate Mrs. J for up to 60 seconds prior to starting. B. Administer 15 cc of sterile fluid into the tube prior to suctioning. C. Suction for no longer than 30 seconds at a time. D. Wait 30 seconds after suctioning before attempting again. The answer is A. Hyperoxygenate Mrs. J for up to 60 seconds prior to starting. Before suctioning a client's endotracheal tube, the nurse should provide extra oxygen for approximately 30 to 60 seconds. Hyperoxygenating a client before suctioning increases oxygen delivery to the tissues and reduces hypoxia that may develop during the procedure. Which of the following conditions is a contraindication for performing a diagnostic peritoneal lavage? A. A client who is 9 weeks pregnant. B. A client with a femur fracture. C. A morbidly obese client. D. A client with hypertension. The answer is C. A morbidly obese client. Diagnostic peritoneal lavage is contraindicated in clients who are morbidly obese because excess body fat makes finding essential landmarks for this procedure difficult. Additionally, the equipment used for the procedure may not be large enough to accommodate an obese person. Finally, morbid obesity puts excess strain on the cardiovascular and respiratory systems, such that anesthetic agents used during the procedure could cause further complications. Which of the following is an example of client handling equipment? A. Wheelchair. B. Height adjustable bed. C. Shower chair. D. Call light. The answer is B. Height adjustable bed. Client handling equipment is designed to reduce the stress and workload on nurses who must assist, turn, or lift clients. This equipment decreases the risk of injuries associated with improper lifting. A height adjustable bed raises the client up to a proper working height for the nurse who must provide assistance. Which practice will help to reduce the risk of a needle stick injury? A. Only expose the end of the needle once ready to enter the room for the procedure. B. Always place the cap back on a needle after it has been used. C. Keep a sharps container nearby where it can be easily accessed. D. Pass needles between nurses by using the handover technique. The answer is C. Keep a sharps container nearby where it can be easily accessed. When administering an injection or using sharps for a procedure, the nurse can minimize safety risks by keeping a sharps container nearby. This provides easy access for quick disposal to prevent the possibility of a needle stick. Needles should never be recapped after use, and nurses should always exchange needles from a central area rather than passing them between workers.